Greetings of the day. I am Sanya from All About Skin Wellbeing. I'm sure all of you must be keeping good health. We all know taking good care of your skin is important for more than just your appearance. As the largest organ, your skin becomes the most essential to your overall health. A fungal infection is very common on your skin or nails. Fungal infection or mycosis are diseases caused by a fungus, yeast, or mold. Mild fungal skin infection can look like a rash and can be itchy and annoying. So let's connect today with a skin expert, Dr. Amrutha HK, live from Bengaluru, to enlighten us on the topic of fungal. Dr. Amrutha HK is MBBS, MD, DVL. She has 5 years of experience in this field. She is a passionate dermatologist with a broad view in terms of holistic dermatological care, intending to care for patients' skincare needs from minor to major skin ailments. Today, Dr. Amrutha HK will share with us on fungal. Doctor, we welcome you on today.
Thank you. Thank you for your generous introduction.
Thank you, doctor. And as we'll be talking about a very important topic that is fungal infection, my very first question to you is that what is basically fungal infection?
See, fungal infection, it's broadly termed as dermatophytosis in medical language. We usually see cases, patients presenting with intense itching, especially in the intertriginous area, meaning their private parts or even in underarms or under their wrists, where especially sweating or even the wetness will be more. There we usually see fungal infections. These are usually broadly termed as dermatophytosis in medical language.
Okay. And doctor, what are the major symptoms of fungal infection? How can someone identify that, this is particularly fungal infection and he or she needs to treat that fungal infection? How can someone see the symptoms that these are the symptoms of fungal infection?
Major symptom would be they'll have intense itching. Secondly, they might see certain discolorations such as brownish or blackish or grayish patches. It's usually seen in again the intertriginous area, especially body folds like underarms, under their breasts, or in between their thighs, or even their groin folds. Okay, these are the usual sites where we see it. It can occur even on their face, hands, or any other body parts. Especially in children or kids, it's usually seen on the scalp. In such cases, it is usually seen as a patchy hair loss. And there are various types in that patchy hair loss again. But when it's seen usually in kids, it will be usually a fungal infection, and the kid will also have itching, and even the mild scales will be there on the patch. This is how
Okay.
we see cases commonly.
Okay, so doctor, that means there is no age limit fungal infection. Small, kid can also have fungal infection to starting from a very young age. Is it not age limited that after youngsters only will have fungal infection?
It can occur in any age group, especially in elderly age group. If they're diabetic or something, they'll be more prone for any kind of infection, not just fungal infection. Usually in kids, it usually occurs on scalp, but these days we are seeing even on the other body parts as well. So there's no age limit as such.
Okay, okay, doctor. And doctor, what are the major causes of fungal infection? Are there any specific causes in these age groups?
Main causes would be the maintaining of not good hygiene and maintaining wearing of any damp clothes, or in rainy season because of increase in humidity it can occur. These are the usual causes. What we tell is to maintain good hygiene, take bath daily. If they're not taking bath daily, also it can trigger. Okay, and in children, it's usually again seen on the scalp because of the variations in the body types. In children, the body type would be different, and in adults, it would be different. So, because of that, it would be seen in scalp usually in children. These are the main reasons as such.
Okay, so that means there are different causes of fungal infection in different people.
Different age group, and in children the infection can spread from one kid to other. They'll be going to school, they'll be in a group of kids. Okay, if infection is there in one kid, it can come to other. And in if they are staying together in home, even through the cloths, the infection can spread. They'll be washing the or dumping the cloths together. If there is any infection in any of the person's cloth, it can spread to the other through the cloths as well. Through the contact also, it can spread.
Okay, so that means it is contagious. If someone is having fungal infection, the clothes, as you've said, and everything should be kept aside and separate. Is
Yes.
it like that?
Yes. Yes, yes. If one person has fungal infection, it's better to wash their clothes or keep their clothes or soak their clothes in a separate container. So maintaining of the basic hygiene is very important.
Okay, so maintaining basic hygiene is very important, as doctor told us. And doctor, what are the most serious fungal infection that happen? And what are the types of fungal infection? Are there any
Yeah.
types as well?
There are various types of the serious fungal infection. Whatever we are discussing now is the it's not very kind of serious or it's not life threatening. There are various other funguses which are life threatening as well, such as the candidiasis, aspergillosis, and even mucormycosis. We might have heard this term mucormycosis, especially during the COVID era. Uh, Especially if they had diabetes prior, infection of such fungus will increase. The prevalence is more in diabetic individuals. So diabetic people should always take care of their health. They should be little more cautious as well. These fungus infections, we call it usually as systemic fungal infections. They are very dangerous as well as life threatening as well. Aspergillosis, as I told, it can even affect your brain. So there can be very much deadly consequences of those infections.
Okay, so that means if it is not treated well, fungal infection can be serious. And doctors, sometimes people also take over-the-counter medication or self-medicate themselves, suggested by some friend or family member that I also had fungal infection. I use this particular, cream or powder. So, what is your suggestion to the people who self-medicate themselves?
Yes, you raise a good point here actually. What we usually see is over the counter medications are rampantly available in the market these days. So there are various combinations with the various brand names available with the different brand names. There'll be multiple combinations in a single cream. They'll be having usually steroid. What that does is they usually subside the itching part, but the infection as such won't subside with the usage of those creams. In such cases, the infection will be still prevalent and it keeps happening again and again in the same individual, or it can even spread to the other individuals with whom they stay together. So, trying out medications on their own is absolutely not recommended. They should consult the nearby the dermatologist and take the treatment according to the guidelines.
Okay, so self-medication and using over-the-counter medication, it is not suggested at all, as doctor said. And doctor, we have discussed about the causes, the symptoms. What are the treatment options which are available for fungal infection?
There are various treatment options depending upon the type of infection they have. See, fungal infection is a broad term. What we usually see is dermatophytosis or tinea, what we call in medical language. Fungal infection can even occur to the nails. As you already asked me, fungal infection, there are deadly fungal infections as well. So, depending on that, the treatment will differ. What we usually see is dermatophytosis. For that, we give topical antifungal creams and antifungal oral tablets. So this is the basic line of treatment. If it's affecting nails, again we should see what type of fungus is affecting the nail, and if they have any underlying diabetes or something, that should be corrected first. Treatment varies according to the type of fungus.
Okay, so treatment varies according to the type of fungus. That means there are different treatment options which are available. People do not need to self-medicate or apply some cream suggested by their friends. Doctor, how long does this treatment takes if somebody is having fungal infection? How long
If
this treatment procedure takes?
treatment as such usually takes 2 months, that is 6 to 8 weeks. Uh, if they are adhering to the treatment guidelines, what we tell properly. If they are not adherent or compliant, then the duration might vary again. And recurrence is also common in this fungal infection. So, adhering to the treatment and being compliant is very important. That's what. If it's recurrence, if it is recurring again and again, then the treatment would be totally different again.
Okay. And doctor, there are a lot of people who don't take treatment seriously and properly. They see the results that, my irritation is gone, my swelling, or the symptoms are gone. They stop the treatment. So, what is your message to the people who do not treat their fungal infection properly? They leave the medicines and treatment in between only.
What usually happens is they'll feel relief in the symptoms, that is itching, as soon as they start medications. If they're taking medications properly, usually itching will subside in again 15 to 20 days, or even up to 1 month. The itching will subside. Then they think that the infection is totally gone, and there's tendency to stop medications. So this is when we see recurrence again. So, as I already told, adherence is very important in fungal infections, and post treatment also, especially in summer season and rainy season, they should be little aware, and they should little keep check on the basic hygiene. Like they can use dusting powder in the body fold areas if sweating is more, or if they are traveling too much or something. Again, if they can use dusting powder in especially sweaty areas. In rainy season, better to avoid damp clothes, and it's advised to dry their clothes completely and iron their clothes and wear. They should stop sharing of towels or anything, and it's advised to wash clothes again daily. So all these things they should maintain. Otherwise, there's chances of recurrence again.
Okay, doctor. So that means people also, sometimes share their clothes with, friends and family. So if somebody is having fungal infection, it is advisable or not?
No, it's not advisable to. I mean, they should strictly adhere to their own clothes. Okay, because again, sharing it's as it's contagious. It can spread even through clothes as well. Especially kids who stay in hostel, or if they're in some rehabilitation centers where people are staying together. Okay, so they should be little more aware of all these things. Awareness should be there among people.
Okay, so that means awareness is important, and if somebody is having fungal infection, the things should be kept separately. And as you have also said that clothes matter a lot. So if somebody is having fungal infection, is it advisable to wear loose clothes and not such tight
Yes,
clothes?
yes, definitely. It's an important point again. It's advisable to wear always loose clothes, especially if they have a recurring fungal infection. All these tights or these jeans, especially, there won't be aeration in tight clothes. Again, it can increase sweating and further trigger fungal infection.
Okay, okay, doctor. And doctor, as you have told us about the various treatment options available, the medications which are available, can oral antifungal drugs be taken during pregnancy?
They are usually avoided unless it's very much necessary in pregnancy, but there are safe medications as well. So it's better to consult the nearby dermatologist and then go with the treatment.
Okay, so it is suggested to take advice from a nearby dermatologist and then take the medications.
Yeah.
Doctor, is it safe to take antifungals long term?
Antifungal long on a long term basis, we should keep check on the basic liver function and kidney function. If it is normal, then if the indication is there, if the indication is demanding to be given it long term, then yes. If the parameters are slightly variable and not within normal limits, then it's not advisable. And especially elderly patients also, certain medications should not be given in long-term basis. There are certain medications which are safe and which are not safe in elderly patients also. So we can't generalize it like we can give or not give. It depends on the parameters of their blood and their health condition as well.
Okay, okay, doctor. And as we are discussing fungal infection, a very important topic, we also have a live viewers watching this live, so we also have their questions as well. So there's a question that can fungal infection be dangerous?
Yes, definitely. As there may various deadly funguses, as I already mentioned, like aspergillosis, mucormycosis, which can invade your body parts, and it can even go to brain or affect any other systemic organs as well. Yes, it's dangerous, but it's a different kind of fungus.
Okay. So that means it can be dangerous if not treated, and sometimes people also ignore the symptoms, and don't go to a dermatologist.
Yes, yes, yes. They think it's some minor thing or it's a small thing, and they tend to ignore it. Only then it can lead to all these complications. Especially in diabetic individuals, they should little keep a check on this. These deadly funguses are more common in diabetic patients or who are on long-term immunosuppressive medications for some other treatment. So they are more prone for this serious fungus.
Okay, that means if somebody is on other than antifungal infection medicine, they are also on some other medication, as you mentioned, that diabetic or some other thing. So they need to take care of these medications.
Yes, yes, yes.
Okay, okay, doctor. And doctor, there is one more question: that are fungal infections painful?
They're usually not. The what we commonly see is tinea or dermatitis. They usually are not painful. They are more of itchy. Okay. Again, as I already told, the deadly fungus can symptoms can vary depending on the type of fungus.
Oh, symptoms can vary depending on the fungus. Doctor, there is another question: that is there a way I can prevent getting ringworm on my feet frequently?
Sorry, come again. I didn't get you.
Is there any way I can prevent getting ringworm on my feet frequently?
Okay, on the feet, they usually are advised to wear open footwear rather than closed footwear like shoes or tight shoes. You prefer wearing open footwear, and if they're having recurrent fungal infection, we advise usually to get their diabetic or sugar level checked. And if it's still occurring in between the toes and all, we can they can keep a cotton ball or round soft cloth in between the toes for aeration. That will also help a lot.
Okay. And doctor, is there any relation that some people do a lot of work in water? So water is also an active member of fungal infection. It can induce fungal infection. Is it like that?
Yes, water, if they're working in water more, like people who are working in any restaurants or hotels or housemaids, if they're working in water more, infections are definitely more prone. Okay, so if they work in such occupational environment also, as far as possible, maintain the area dry. You wash the after washing hands or the feet, they can wipe it off and keep the area dry. That's usually what we advise.
Okay, doctor. Doctor, there's live viewers question. I will be reading that to you. That can fungal infection affect the immune system?
Not as such. Okay, don't. It's not a the what we commonly see is dermatophytosis. It won't affect the systemic, meaning it won't affect the internal organs as such. So immune system is not usually deranged. But in people who are having low immunity, their infections are again more common.
Okay. And doctor, is it like that fungal infection is genetic as well? If someone in the family have the history of fungal infection, so is it genetic?
Genetically, if they are predisposed, then any kind of disease or any kind of infection, they'll be more prone. Okay, so like genetically predisposition, meaning some people they'll be having tendency to sweat a lot. All these things are genetically predisposed. If they're sweating a lot or something, that nobody can help it from outside to decrease the sweating. Because their treatment and their separate medications if they're having hyperhidrosis or too much of sweating. But if they are genetically predisposed and if they have more sweating, then definitely they are more prone for infections.
Okay, so sweating is another symptom, and is another active. It can active the fungal infection if the person is
Yes,
sweating.
yes.
Okay, okay, doctor. And doctor, any dietary precautions for the people, to be safe from fungal infection, or the people who are having fungal infection can take some dietary precaution that would help.
No, nothing as such. Dietary precautions for fungal infection. They can consume their daily foods, whatever they are consuming, but they little should they should a little keep check on healthy foods. Okay, they should consume healthy foods. I mean, okay, like fruits or even green leafy vegetables, which are again immune boosters. Okay, so if the immunity is good, then they'll be not prone for infections as such.
Okay, so good immune system and healthy. If they want,
Diet.
they get
Yes.
healthy diet. And we are talking about healthy diet. And there's a question from a viewer that can fungal infection occur in healthy people?
It can occur because fungus is not just about the good immune system or maintaining a healthy diet. There are various factors to cause fungal infection. For example, if they are traveling for a long duration for the work on a daily basis, they'll be mainly they'll be sitting for a prolonged duration. Okay, this can also again if they're wearing tight clothes or something. There are various triggering factors for fungus. If they're healthy also, they should keep check on other things as well.
Right. So, I mean, being healthy is good, but you need to take care, proper precautions. Doctor, when people travel in public transport, and it can also be transmitted to that. If somebody is having fungal infection, and traveling and going around, so can fungal infection be transmitted from that?
Fungus, yes, fungus can occur because of any means of contact. Okay, if they are staying together, okay, or if they're traveling together, if they are sharing clothes, okay, if they are sleeping together, okay, any form of contact can transmit fungal infection.
Okay, so that means proper precautions need to be taken, because as you have told us that it can be transmitted from one person to another. It is contagious. Doctor, there's another weird question that can wearing damp clothing cause fungal infection?
Yes, definitely. Damp clothes is one of the commonest factor why fungal infection occurs, especially in rainy season when clothes are not drying out completely. So in such cases, it's important to iron their clothes, okay? Because ironing, because of the heat, whatever the fungus is there, it will get destroyed or damaged. In such cases, ironing their clothes and wearing is a extremely important step. What we advise.
Okay, so clothing is important, and wearing loose clothes can help, doctor.
Definitely, wearing loose clothes, avoiding the tight clothes, or avoiding the closed footwear, all those things will help prevent fungal infection.
Okay. And doctor, sometimes also, when people have fungal infection in nails, they, their nails, appear differently. So, what is your suggestion to the people? People also bite their nails instead of going to a dermatologist. They think, if they cut it or bite it, it will go away. Is it like that? And what is your suggestion to the people who, do this?
Who tend to bite their nails, you mean?
Yes.
No, all biting nails. I mean, it doesn't have any relation with fungal infection. But if fungus is there on nails, we call it onychomycosis. In such cases, also treatment should be done properly. Just biting out nails or even cutting it, the fungus won't go out from the nails. So, any fungal infection for the nails takes longer duration than the usual fungal infection if it occurs on the other body parts. It takes longer duration to get cured completely. So, being vigilant and compliant to the treatment with the regular follow-ups is extremely important to have it on the nails.
Okay, okay, doctor. And sometimes people also take home remedies, applying some oil or applying some type of home remedies. So, is it advisable to use home remedies, and how long this home remedies can work?
See, if everything can be treated on home remedies, then why are we here actually? It won't work like that. So, home remedies won't cure the fungal infection. It has to be treated on a proper guidelines, and strict adherence to the guidelines is equally important. There's no home remedy as such to advise like follow this, it will go. Okay, don't go like that.
Yes. So as you said that it don't go like that, but people, nowadays people are on social media. People advise, if you apply this, you apply this, the fungal infection can be gone within 3 days, within 4 days, short-term measures. So what would your suggestion to the people who don't go to a dermatologist, but see all this and think that let's see.
You raised a good point here. We are seeing so many posts on the media like if you have this, follow this. If you have this, follow this. But how do they get to know that if they have that? Okay, so to get it diagnosed as fungal infection itself, they should first visit the dermatologist. Okay, they might think it as fungus, but it can be something else also. In such cases, if they apply whatever is shown on the media, it won't subside. In fact, it will increase. So don't apply or self-medicate the over-the-counter medications. Consult your dermatologist who is nearby.
Yes, very, very, very well explained that, is it fungus infection or not? How do we know, or how the person is who is having the symptoms is fungal
There'll
infection
be
or not?
similar kind of lesions. Okay, there are 100 types of lesions which look similar. That is what we are specialized in, and that is what we do.
Yes, so a dermatologist can only see and examine that this is fungal infection and you need to treat that as possible. Doctor, what are the myths you would like to clear about fungal infection? That don't do this or don't do that. What are the myths you have come across and you want to clear it?
Myths, there's nothing like myths as such, but the most common thing we see is applying of the over-the-counter medications, okay, which usually contains steroid and some irritants as well. And one more worst thing what I've noticed is people apply medication called salicylic acid, okay. So it is actually damages skin or kind of irritates the skin. So the lesion, whatever is there, it would get distorted, and it gives a challenge to a dermatologist to diagnose because the whatever the morphology or the type of lesions, it would have been distorted. Identity of the lesion is distorted totally. So in such cases, it's a challenge for a dermatologist to diagnose. So don't make it even more worse. So in fact, rather consult and apply the proper medications. This is what I would. This is what I would like to tell.
Okay, so don't use over-the-counter medication, and as early as possible. You think any kind of symptom. We have discussed about the symptoms, the causes, the treatment. You can go to the nearby dermatologist. Doctor, there's another question that can I stop taking antifungal treatment if symptoms get better earlier?
No, definitely not. Okay, there's a this the fungal infection has tendency to come back or recur back if they stop the medications early rather than taking it for advised duration. So they shouldn't stop it early. They should complete the course. Even after completion of the course, there's a mandatory follow-up is needed. Only then they'll know whether the fungus has completely subsided or the lesions are still there.
Okay, so take proper medication, full treatment. We can say the full course of fungal infection medication.
Yes.
Okay, doctor, there's another question that why does fungal infection occur again and again?
Uh, Fungus is becoming a challenging thing to treat these days. Challenging and yet most common thing what we see these days. People try out medications randomly, and certain times what happens is they would have developed resistance. Okay, resistance is one worst thing what we can tell. If they're resistant, they stop responding to the available medications. In such cases, it's difficult to treat. So, advising proper follow and following up the treatment is equally important.
Okay, so very well explained. And there's one more question: that what antibiotics treat fungal infections?
Sorry, what?
What antibiotics treat fungal infection?
Antibiotics won't treat fungal infection. Fungal infections are to be treated with antifungal medications. And again, it's a broad terminology. Okay, so there are certain medications like itraconazole or terbinafine or even fluconazole. Okay. It has to be given at the right dose and right duration according to the body type and body weight. Only then the fungal infection can be cured.
Okay, right, doctor. And as you mentioned, that right dose at the right time. Sometimes people also do, if they have a lot of fungal infection, they, whatever the medications or cream they have, they apply it more that, it will gone soon, because people don't want, that longer treatment. They want it short. So, what is your advice to the people who overdose the medications, the
Every,
cream? They apply more
everything
that,
has to
it will gone soon.
be. Yes, everything has to be given at a right dose and for right duration. Even I mean, stopping the medications earlier is also not advised, and overdosing is also not advised, because again, there's a problem of resistance and all. Okay, so we usually call follow after advised duration to avoid the overdosing or prolonged duration of the medications. So anything less or anything more is not advised. It should be taken at a right dose and for a proper duration.
Okay, so right dose at the proper duration, and do not overdose, do not self medicate. Doctor, any suggestions you would like to give to all our viewers who are watching this live?
Main advice for fungal infections are be careful in summer season and rainy season, because infections are more prone, especially during these seasons. Avoid wearing damp clothes, completely dry the clothes and wear, and change your towels, clothes, everything daily. And keep washing your clothes separately, especially you have fungal infections. Uh, and also, if you have any kids or children in home, better to stay away from them and avoid contact, because it can spread even to kids. There's no age limit as such. Yeah, this is the advice.
Okay, so stay away from the people, and especially from the kids, as you mentioned, that it is important.
And
Uh,
importantly, do not self-medicate.
do not self medicate. Yes, that's a very important message, that do not self medicate. Doctor, there's another question: that how to take care of fungal infection and how to tackle the same.
Taking care of fungal infection, again, as I already mentioned, they should keep check on the dampness of the clothes, and they should keep their clothes separately and wash their clothes separately in lukewarm water or mild warm water, and preferably wear loose clothing, as you already told. And take the medications properly for the advised duration, and keep following it up until it subsides completely, and until the doctor tells it's subsided completely. Don't judge yourself that it's subsided completely and stop the medications in between. We usually tend to tell use the topical medications for even longer duration, even after its subsidence 2 or 3 weeks more. Okay, so following it up is important.
Okay. And doctor, is it like that, if someone is having fungal infection, and they are itching, they have itching, and they are touching it in the other parts as well. So will it spread like that as well? Did fungus spread like that as well in other body parts as well?
Yes, definitely. It's a good point again. If they have infections in some other body part, and if the scratch, usually it will be too intense itching will be there. Okay, they'll have tendency to scratch it again and again. So if they scratch it, and if they touch body part or scratch in other body parts, their chances are it can spread even there as well. So better to avoid scratching as much as possible, and avoid touching the other body parts as also.
Okay, so that means they need to take care of themselves very minutely. They need to, as you have already mentioned, that separate clothes, and you need to be away from people for some time and take proper medications. And we have discussed about the treatment, the causes, the various things which are related to fungal infection. Before we end this very informative live session, any takeaway message for all our viewers?
Takeaway message or take home message is consult your dermatologist and do not self medicate and take better care of yourself and your health.
Okay, so do not self-medicate. Take care of yourself, and as advised by Dr. Amrutha, that do not self-medicate at all, because the symptoms can get worse, and please take proper care of yourself. And doctor, one last question before we end this question: are these fungal infections also affect the mental health, and people don't go outside because they have fungal infection? So social gathering is suggested or not suggested to the people who have fungal infection?
Social gathering they can go, but again a little check on the like if they have fungal infection in any body part, if they scratch and tend to touch other individuals, all those things should be avoided. Okay, so other than that they can go to social gathering and lead a normal life, because they have fungal infection, they need not stay in a closed space or restrict themselves to home. Okay, they can be social, very much social. So that's what. Little keep on check on their hygiene. That's all.
Okay, so proper precautions, and as you have mentioned, that if they take care of themselves, this can help them. Thank you so much, Dr. Amrutha HK, for your valuable time, and it has been very informative, quite an informative session for all our viewers, and we really look forward for many more such sessions in the coming time as well, Doctor.
Okay. Thank you. Thank you for having me here.
Thank you. Thank you so much, Doctor. And thank you so much, viewers, for your excellent participation. For more information and updates on skin health and care, stay connected on our Facebook page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Take care of yourself. Good day to you all.
Thank you.